We are answering your questions about the coronavirus with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. This person says there's a lot of incentives going around for people to get vaccines, gift cards and such. Could people come back and get another? Is there anything stopping them from doing so? And is it dangerous if they got more than one? So let's take the first one. Can people come back to get, another one? Is there anything stopping them?
So I hope that wherever they're getting their vaccines, it is logging into our state registry, which tracks where your doses are being administered and what the date is associated. So I'm hoping there are not too many people who are getting dosed by all the different vaccines because of the incentive.
Okay, so then what could happen? Do we know what could happen if we had more vaccine than we should be getting?
I think in theory, some people may start having higher side effects, because of that additional dose. And it really depends on the timing, but I'm not sure if we know. And I'm hoping that's not the case, that we know when they go to a site to get their vaccine that they would get some of those details. Mm-hmm. But there are some other, I would look into other options, like they're probably, if somebody wants to, is interested in getting that type of benefit, I would talk to them and see, what other options there are. I think that's a very rare case that someone is going out and getting multiple doses of the different vaccines for the gift card.
For the $25, maybe you bring someone who's not vaccinated and you split
Yes.
that $25. Okay.
Yes.
All right. This person is saying, is it true that the J&J vaccine is only 67% effective?
So the rates, the J&J vaccine is effective. It's probably, I would say, higher in the 75, 76%. When you look at its impact on variant disease, it's still highly effective in preventing severe disease and hospitalization, and that's what you want. And it's a little bit of apples and oranges when you compare Moderna, Pfizer, and J&J. Moderna and Pfizer, they were able to test their vaccine early on and had the COVID vaccine, the COVID virus that was circulating last year. And so they had a high, efficacy of 90, 95%. When you look at that same circulating virus, the J&J is probably about 85%. And then they're all probably comparable when you're talking about the variant SARS-CoV strain that's now circulating in the U.S. and in North Carolina.
Mm-hmm. Okay. This person is saying if someone got their first mRNA vaccine, then they got COVID, do they start the vaccine series all over again, or do they just get their second dose?
So that's a great question. So unfortunately, that person probably they were just partially immune, still got COVID. They would just finish out the second series, the second dose. They don't have to start over again.
Okay. This person is saying, I have a friend who has lupus. From what we can tell, there's no information from the Lupus Foundation about the vaccine, and we're wondering, should it be taken?
There are very few contraindications to getting the vaccine. And it's really the folks that should not get it are those who have allergies to the specific components to the vaccine. So somebody who has lupus should still go on to getting vaccinated, because we want to minimize the risk of, if they have other health problems, they may be at risk of getting really severe COVID disease.
Okay. Sorry about that. We just had a funny thing there with our camera. All right. So this person is asking, how long after having COVID should you wait to get the vaccine?
So in the beginning, we used to say that you had to wait a few months, about 4 to 6 weeks. But since there's so much ample vaccine now that's available, as soon as the person is feeling recovered, they can start the series and go from there. So it could be as quick as 2 weeks, but really, if you've had COVID disease, you probably have enough immunity in your system for easily 3 months.
Okay, and this person is saying, my question is that if you had COVID-19, do you still need to wear a mask around other people?
Oh, I know, right? We're talking about somebody, how do you differentiate somebody who's been vaccinated and has had, vaccine-induced immunity versus somebody who's had COVID? So the key thing is that that person's probably immune. But our thought is we don't know how long ago you've had COVID and if you're still immune. So there's a timing aspect of it. So if I still think we still recommend folks who've had COVID to still get vaccinated, just to ensure that you have the proper immunity to last, and going from there. Technically, they're immune, so they have some protection against getting exposed, and so they may not need to wear a mask.
You just don't know whether it's 3 months or 6 months or whatever.
Yeah, and so I think that's still too risky. So I would say the person that's had COVID and has yet to have the vaccine, it's still super important for them to, roll up their sleeve and get that shot in their arm.
So this person is asking, will the vaccine protect longer than 6 months, and will there be a booster?
I think that's the biggest question that weighs on a lot of folks' minds right now in certain circles. Last week, I think the folks from Moderna had mentioned that they noticed that the antibodies started to trend down after 6 months. And the key thought is that we're not sure what that sweet spot is of when do we need a booster? And even that our antibodies are trending down, doesn't it mean that we still have enough to fight off infection? So I would not be surprised if we needed to have a booster towards the fall and winter, but we're still unsure yet, and I believe studies are underway to try to decide when that that booster shot should come.
Okay, well, you can continue to text your questions to 336-379-5775. We've got one last segment coming up. We'll be right back.